Welcome to the RxMinute, brought to you by Rx Benefits. In this segment, we'll discuss drug tiers and formularies. What is a formulary? A drug formulary is a list of prescription drugs, both generic and brand name, created by a committee of physicians, nurse practitioners, and pharmacists, which they feel offer the greatest overall value. This value is determined by several factors, including, but not limited to, the prescription's effectiveness and cost. What is a drug tier? A tier is a category for drugs. The tier that your medication is in will determine your portion of the drug cost. A typical drug benefit includes 3 or 4 tiers, and sometimes as many as 5 tiers. What's the difference in each drug tier? Tier 1 drugs usually include generic medicines and have the lowest out-of-pocket costs. Tier 2 drugs usually include preferred brand name medications and some high-cost generics and have a mid-range cost. Tier 3 drugs usually include non-preferred and brand name medications and tend to be high-cost drugs. You may want to ask your doctor if there are lower-cost options that might work for you. Tier 4 drugs usually include specialty and biosimilar medications, and these drugs almost always require a pre-authorization and evidence from your doctor that you don't have a less expensive option. A medication's tier placement can be dependent on whether it has been proven to be safe or effective, or if there is a similar drug on a lower tier of the formulary which may provide the same benefit at a lower cost. As medications are developed and studied, they can be moved to a different tier. This means the cost could also change. To determine if a medication is covered and which tier it falls into, it's recommended that you review your most recent formulary so you know what to expect when you fill a prescription at the pharmacy. We hope you found this information helpful. Thank you for watching this edition of the Rx Minute, brought to you by Rx Benefits.